Welcome to your daily affirmation for spiritual, physical, and financial health and wholeness. Take a deep breath. And let's begin this journey together. Today, I embrace my divine power and inner strength. I am whole, I am worthy, and I am abundant in every area of my life. I am connected to the infinite source of love, wisdom, and peace within me. My spirit is radiant, and I move through life with grace and purpose. I trust that the universe supports my highest good, and I align myself with divine energy. Every challenge is an opportunity to grow, and every blessing reminds me of my sacred purpose. Today, I choose love, faith, and gratitude. My spirit is nourished, and my soul is at peace. My body is a temple, and I honor it with care and respect. Every cell in my body is vibrant and alive with energy. I am strong, resilient, and capable of achieving anything I set my mind to. I fuel my body with nourishing foods, hydrate with intention, and move with joy and gratitude. I listen to my body's needs and trust its wisdom. I radiate vitality, and every breath I take renews and refreshes my being. I am grateful for the gift of my health and honor it daily. Abundance flows to me effortlessly, and I am open to receiving all the wealth and prosperity the universe has to offer. I release any limiting beliefs about money and embrace a mindset of limitless possibilities. I am deserving of financial success, and I manage my resources with wisdom and purpose. Every dollar I earn and spend contributes to my growth and the betterment of my life. I attract opportunities that align with my values and purpose, and I trust that my financial future is secure. Today, I step boldly into my power and claim the life I deserve. I am unstoppable in pursuing my dreams, and I face challenges with courage and determination. I release fear, doubt, and comparison and replace them with confidence, self-love, and perseverance. My unique gifts and talents are valuable, and I share them with the world unapologetically. I choose to be present in each moment, finding joy and gratitude in the small blessings of life. I am surrounded by love, support, and opportunities for growth. I am not defined by my past or circumstances, but by the limitless potential within me. I am a woman of purpose, strength, and vision, and I am committed to creating a life that aligns with my deepest desires. Each day is a new beginning, and I embrace it with enthusiasm and determination. I am disciplined, focused, and intentional in my actions, knowing that every step I take brings me closer to my goals. I am proud of the woman I am becoming and celebrate every victory, no matter how small. Today I affirm my worth, my power, and my purpose. I am whole, I am healthy, I am abundant, I am unstoppable, and so it is. Thank you for joining me on this journey. Remember, every step you take is a step towards a better you. Until next time, stay inspired and keep moving forward.
Hi everyone, and welcome to our YouTube channel. In today's video, we'll be diving into a topic that affects many women, the impact of stress and lack of sleep on menstrual periods. It's no secret that stress and sleep can significantly impact our overall health, but did you know that they can also affect our menstrual cycle? We'll explore the science behind this connection and discuss some practical tips for managing stress and improving sleep to promote healthy periods. So if you're curious about how stress and sleep affect your menstrual cycle, watch this informative video. The connection between stress and hormones is complex and involves multiple physiological pathways. When our bodies experience stress, the hypothalamus pituitary adrenal axis is activated, releasing cortisol from the adrenal glands. Cortisol is a steroid hormone that helps the body respond to stress by mobilizing energy stores and suppressing non-essential functions such as digestion and reproductive processes. However, when cortisol levels remain elevated for prolonged periods, it can disrupt the balance of other hormones in the body, including those involved in the menstrual cycle. For example, high cortisol levels can suppress gonadotropin-releasing hormone production. This hormone stimulates the release of follicle-stimulating hormone and luteinizing hormone from the pituitary gland. These hormones are essential for developing and releasing eggs from the ovaries and producing estrogen and progesterone. Stress can also disrupt the communication between the ovaries and the brain, leading to irregular or absent ovulation. This disruption can cause changes in the menstrual cycle, such as longer or shorter cycles, missed periods, or heavy or light bleeding. Similarly, lack of sleep can also affect our hormonal balance. During sleep, our bodies produce and release various hormones, including growth hormone, melatonin, and cortisol. Disrupting our sleep patterns can alter the timing and amount of hormone release, leading to imbalances and irregular menstrual cycles. In addition to irregular periods, stress and lack of sleep can lead to various menstrual-related symptoms. For example, many women experience painful menstrual cramps caused by the contraction of the uterus as it sheds its lining. Also, bloating is a common symptom of premenstrual syndrome caused by hormonal changes in the body. Stress and lack of sleep can worsen bloating by increasing cortisol levels, leading to body fluid retention. Mood changes such as irritability, anxiety, and depression are common symptoms of premenstrual syndrome. Stress and lack of sleep can exacerbate these symptoms by affecting neurotransmitter levels in the brain, such as serotonin and dopamine. Therefore, it's essential to prioritize stress management and quality sleep to promote healthy menstrual cycles and reduce severity of these symptoms. Stress management techniques like deep breathing, meditation, and yoga can help reduce cortisol levels and promote relaxation, improving overall well-being. Additionally, establishing a consistent sleep schedule and limiting screen time before bed can help improve sleep quality. It's important to note that if you experience severe or persistent menstrual-related symptoms, it's always a good idea to consult your healthcare provider. Let's discuss some practical tips for managing stress and improving sleep. One effective stress management technique is to practice relaxation techniques. Practicing relaxation techniques is a proven way to manage stress and improve overall health and well-being. These techniques can help reduce muscle tension, decrease heart rate and blood pressure. Let's see a few specific techniques that can help manage stress. First one is deep breathing. It is a simple but effective relaxation technique that can be practiced anywhere, anytime. This technique involves taking slow, deep breaths, focusing on your breath and relaxing your body. Deep breathing can be especially helpful during stress and anxiety, or when you need to take a break and relax. Focusing on your breath and allowing your body to relax can reduce cortisol levels, decrease heart rate and blood pressure, and promote a sense of calm and relaxation. Second is meditation. Meditation is a relaxation technique used for thousands of years to promote a sense of calm, relaxation, and mental clarity. It involves focusing on a specific object, sound, or phrase to calm your mind and promote relaxation. Incorporating meditation into your daily routine can be a powerful way to manage stress. Even a few minutes of meditation each day can make a difference in how you feel and approach stressful situations. Third is yoga. Yoga is a physical practice that has been around for thousands of years and has gained widespread popularity recently. It combines breath work and movement to promote relaxation, reduce stress, and improve overall health and well-being. Incorporating yoga into your daily routine, even just a few minutes a day, can significantly impact your physical and mental health. Whether you attend a class or practice on your own, the benefits of yoga are undeniable and can help you manage stress and improve your overall quality of life. In addition to these relaxation techniques, improving sleep quality can effectively manage stress and support hormones. A few tips for improving sleep quality are: first is establish a consistent sleep schedule. Going to bed and waking up at the same time every day can help regulate your body's internal clock and improve sleep quality. Second is create a relaxing sleep environment. Make sure your bedroom is quiet, dark, and cool, and remove any distraction that may interfere with sleep, such as electronic devices. Third is limit screen time before bed. The blue light emitted by electronic devices can disrupt your body's production of melatonin, a hormone that helps regulate sleep. Try to avoid using electronic devices for at least an hour before bed. Incorporating these practical tips into your daily routine can help manage stress, improve sleep quality, and support healthy menstrual cycles. In conclusion, stress and lack of sleep can significantly impact our menstrual cycles, leading to hormonal imbalances, irregular periods, cramps, and mood changes. However, by practicing stress management techniques like deep breathing, meditation, and yoga, along with establishing a consistent sleep schedule, we can improve relaxation, reduce stress, and enhance sleep quality. Please like the video, subscribe to the channel, and share it with others to spread awareness about the impact of stress and lack of sleep on menstrual periods. Hi everyone and welcome to Women Health Project. In this video, we will discuss about menopause and strategies to manage menopause symptoms. Menopause is a natural biological process that marks the end of a woman's menstrual cycles and reproductive years. It is primarily driven by the decline in the number of eggs in a woman's ovaries and the reduction in reproductive hormones, particularly estrogen and progesterone. Women are born with a finite number of eggs, and over the years, this number gradually decreases. Menopause typically occurs between the ages of 45 and 55. It is diagnosed after 12 consecutive months without a menstrual period. Now, let's discuss stages of menopause. First one is perimenopause. This is the transitional phase leading up to menopause, often starting in the mid-40s. Women may experience irregular periods and symptoms like hot flashes and sleep disturbances. This phase can last for several years as the number of viable eggs continues to decrease. Second one is menopause. This stage is reached when a woman has gone 12 months without a menstrual period. The ovaries cease releasing eggs and producing most of their estrogen. It typically occurs around age 51. Third one is postmenopause, the years following menopause. Symptoms may ease for many women, but health risks related to low estrogen levels, such as osteoporosis and heart disease, increase. Now let's discuss common symptoms. First is hot flashes and night sweats, sudden feelings of heat that spread over the body, often accompanied by sweating and sometimes followed by chills. Second is vaginal dryness and discomfort during intercourse. Thinning and drying of the vaginal walls can lead to discomfort and pain during sex. Third is sleep disturbances, difficulty falling asleep, staying asleep, or experiencing restful sleep. Fourth is mood swings, irritability, and depression. Hormonal changes can affect mood stability. Fifth is weight gain and slowed metabolism. Many women experience an increase in abdominal fat and changes in their metabolism. Last one is thinning hair and dry skin. Reduced estrogen levels can lead to hair thinning and skin changes. Now let's discuss the strategies to manage menopause symptoms. First one is lifestyle modifications. Diet is an important factor in lifestyle modifications. Incorporate a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Foods high in calcium and vitamin D are particularly important to support bone health. Avoid caffeine, alcohol, and spicy foods to reduce hot flashes. Increasing fiber intake can also help manage weight and improve overall health. Another one is exercise. Regular physical activity can help manage weight, improve mood, and strengthen bones. Aim for at least 30 minutes of moderate exercise most days of the week. Weight-bearing exercises like walking, jogging, and strength training are particularly beneficial. Yoga and Pilates can enhance flexibility and reduce stress. Last one in lifestyle modification is sleep hygiene. Maintain a regular sleep schedule, create a restful environment, and avoid caffeine and electronics before bedtime to improve sleep quality. Techniques such as deep breathing, meditation, and relaxation exercises can also enhance sleep. Using a fan or air conditioner can help with night sweats. Second strategy is hormone replacement therapy, HRT. Estrogen therapy play an important role, effective for relieving many menopausal symptoms. It comes in various forms, including pills, patches, gels, and creams. Women who still have a uterus will need a combination of estrogen and progesterone to prevent endometrial cancer. There are some risks and benefits. HRT can increase the risk of certain conditions such as blood clots, stroke, and breast cancer. It's important to discuss the risks and benefits with a healthcare provider. Short-term use at the lowest effective dose is often recommended. Third one is alternative therapies. Use phytoestrogens, plant-based estrogens found in soy products, flax seeds, and certain herbs may help some women, though research is mixed. Foods rich in phytoestrogens include soybeans, tofu, tempeh, and flaxseed. Use herbal supplements. Black cohosh and red clover are popular, but their effectiveness and safety are not well established. Always consult with a healthcare provider before starting any supplement. Some women also use evening primrose oil, though its benefits are not conclusively proven. Acupuncture is also effective in managing menopause symptoms. Some women find relief from symptoms through acupuncture, though scientific evidence is still inconclusive. This practice may help reduce the frequency and severity of hot flashes. Fourth one is mind-body techniques. Yoga and meditation play an important role. These practices can reduce stress and improve overall well-being. Yoga, in particular, can improve flexibility and reduce the severity of hot flashes. Meditation and mindfulness can help manage stress and enhance emotional health. Deep breathing and relaxation exercises can also manage symptoms. Techniques such as paced respiration can help manage hot flashes and improve sleep. Practicing deep, slow breathing at the onset of a hot flash can reduce its intensity. Progressive muscle relaxation and guided imagery can also be beneficial. Last strategy is vaginal health. Use moisturizers and lubricants. Over-the-counter products can alleviate vaginal dryness and discomfort during intercourse. Water-based lubricants are often recommended. Silicone-based lubricants can provide longer-lasting moisture. Vaginal estrogen therapy is also effective. Low-dose estrogen therapies, available as creams, rings, or tablets, can be very effective for treating vaginal symptoms with minimal systemic absorption. These treatments focus on relieving local symptoms without significant effects on the rest of the body. There are few effects of menopause on women's health. Let's discuss one by one. First one is menopause can affect cognitive function. Some women report experiencing brain fog or memory lapses during menopause. This can be linked to fluctuating hormone levels, particularly estrogen, which is known to play a role in brain function. Second one is heart health risks increase. Postmenopausal women have a higher risk of cardiovascular disease due to the drop in estrogen levels. Estrogen is believed to have a protective effect on the inner layer of artery walls, keeping blood vessels flexible. Third one is bone density decreases rapidly. The first few years after menopause are critical for bone health, as the rate of bone loss increases significantly due to lower estrogen levels, leading to an increased risk of osteoporosis. Fourth one is menopause symptoms can last longer than expected. While many believe that menopausal symptoms last only a few years, some women experience them for a decade or more. Fifth one is weight distribution changes. Hormonal changes can lead to a shift in fat storage from the hips and thighs to the abdomen, increasing the risk of metabolic conditions. Sixth one is impact on dental health. Menopause can affect dental health, causing dry mouth, gum recession, and an increased risk of periodontal disease due to hormonal changes affecting oral tissues. Seventh one is increased risk of urinary incontinence. The decline in estrogen levels can weaken the pelvic floor muscles, leading to urinary incontinence. Regular pelvic floor exercises can help strengthen these muscles. Last one is joint pain and stiffness. Hormonal changes can lead to joint pain and stiffness, a symptom that is not commonly associated with menopause but affects many women. Support systems play an important role in managing menopause symptoms. First is family and friends. Having a strong support system of family and friends can help women navigate the emotional and physical challenges of menopause. Second is support groups. Joining a support group, either in person or online, can provide a sense of community and shared understanding. Third is healthcare providers. Regular checkups with healthcare providers who understand menopause can help in managing symptoms and maintaining overall health. In this video, we discuss that menopause is a significant life transition that affects each woman differently. This natural process marks the end of menstrual cycles due to hormonal changes. By understanding the stages perimenopause, menopause, and postmenopause, and recognizing symptoms like hot flashes, night sweats, and mood swings, women can better navigate this phase. Exploring a variety of management strategies, including lifestyle modifications, hormone replacement therapy, and alternative treatments such as yoga and acupuncture, can help women find relief and maintain their quality of life. It's essential to always consult with a healthcare provider to tailor treatments to individual needs and health profiles, ensuring the most effective and personalized care. If you find this video helpful, then subscribe to our channel for more health and wellness tips. Don't forget to like, comment, and share your thoughts on menopause. If you find this interesting, you will also enjoy our other linked videos.
Hey everybody, welcome back to my channel. Today we're talking about something so many of you have been asking about: how to grow healthy, strong, beautiful hair. We're diving deep into the top 7 things you can do to ditch the wigs and rock your natural hair with confidence. We'll be covering everything from the inside out, because true hair health starts with how we treat our bodies and our hair. Whether you're dealing with damage, struggling to grow your hair, or just want to amp up your hair care routine, this video has something for you. So grab your notebooks, your favorite hair mask, and let's get started. Okay, first things first. Let's talk about embracing your natural hair. We live in a world obsessed with changing our looks, but there's a special kind of freedom that comes from loving what makes you, you. For so many years, I struggled with accepting my natural hair texture. I straightened it, I curled it, I put it through so much just to fit in with a certain ideal. But you know what? It damaged my hair. It took time and a lot of self-love to realize that my natural hair is beautiful just the way it is. And that's what I want for you too. Embracing your natural hair starts with ditching the harsh chemicals, the relaxers, the treatments that promise the world but often leave your hair dry and brittle. Those harsh chemicals? They might seem like a quick fix, but trust me, they often do more harm than good in the long run. They strip your hair of its natural oils, leaving it vulnerable to damage and breakage. Instead, focus on nourishing your hair from within. That means eating a balanced diet, drinking plenty of water, and using gentle natural hair products that work with your hair, not against it. Remember, healthy hair is strong hair. It's about embracing your natural texture, whether it's curly, coily, straight, or somewhere in between. It's about giving your hair the love and care it deserves so it can thrive. And trust me, when you start loving your natural hair, you'll be amazed by how much healthier and more vibrant it becomes. Now let's talk about a game changer in the hair care world: PRP treatments. PRP stands for platelet-rich plasma, and it's basically like magic for your hair follicles. Here's how it works. They draw a small amount of your blood, spin it in a centrifuge to separate the platelet-rich plasma, and then inject that plasma back into your scalp. Sounds a little intense, I know, but trust me, it's not as scary as it sounds. The platelets in your blood are like little repair machines. They contain growth factors that stimulate collagen production and cell regeneration. When injected into your scalp, they work their magic on your hair follicles, making them stronger and healthier. PRP can be incredibly effective for those struggling with hair loss or thinning. It can help to thicken existing hair, promote new hair growth, and even slow down the hair loss process. Now, PRP treatments aren't a one-time fix. It usually involves a series of treatments over a few months followed by maintenance treatments. But let me tell you, the results can be incredible. I've seen firsthand how PRP has transformed people's hair, giving them back their confidence and their hairlines. If you're considering PRP, definitely do your research, talk to a qualified professional, and see if it's the right fit for you. Now, let's talk about the foundation of healthy hair, good hair care habits. These are the little things we do every day that make a world of difference in the long run. First up, regular trims. I know you're trying to grow your hair longer, but trust me, getting rid of those split ends is crucial. Split ends are like the enemy of hair growth. They travel up the hair shaft, causing more damage and breakage. Getting a trim every 6 to 8 weeks will help prevent split ends and keep your hair looking its best. Next, let's talk about heat styling. I love a good blowout or a sleek straight look as much as the next person, but excessive heat styling can really damage your hair over time. Whenever possible, try to let your hair air dry or use heat protectant spray religiously before applying any heat. And when you do use heat tools, make sure they're set at a lower temperature to minimize damage. Another important tip is to be gentle with your hair, especially when it's wet. Wet hair is more prone to breakage, so avoid brushing it when it's soaking wet. Instead, use a wide-tooth comb or your fingers to gently detangle it. And lastly, invest in a good silk or satin pillowcase. Cotton pillowcases can create friction, leading to tangles and breakage. Silk or satin pillowcases, on the other hand, are much gentler on your hair, helping to prevent those dreaded bedhead tangles. The patience of long, strong hair. Let's be real. Growing long, strong hair takes time and patience. It's not a sprint, it's a marathon. But with the right approach, you can definitely achieve your hair goals. One of the best things you can do to protect your hair and encourage growth is to wear protective styles. Think braids, twists, locks, or even wigs that are sewn in properly. Protective styles help to minimize manipulation and protect your hair from the elements, allowing it to grow without being constantly fussed with. Another crucial factor in hair growth is scalp health. Just like healthy soil is essential for plants to grow, a healthy scalp is crucial for healthy hair growth. We'll dive deeper into scalp care later, but for now, just remember to keep your scalp clean and free of buildup. And lastly, be patient. I know it can be frustrating to wait for your hair to grow, but trust me, good things take time. Avoid comparing your hair journey to others. Everyone's hair grows at a different rate, and what works for one person might not work for another. Focus on your own journey, celebrate small victories, and remember that consistency is key. Feed your hair from within. You know the saying, you are what you eat. Well, it's true for your hair too. What you put into your body directly affects the health and growth of your hair. One of the best things you can do for your hair is to eat a balanced diet rich in protein, healthy fats, vitamins, and minerals. Think of it as giving your hair the building blocks it needs to thrive. Salmon is a fantastic source of omega-3 fatty acids, which are essential for scalp health and hair growth. Eggs are another great option, packed with protein and biotin, which is crucial for hair strength and growth. Leafy green vegetables like spinach are loaded with iron, which is essential for carrying oxygen to your hair follicles. And don't forget about nuts and seeds. They're a great source of zinc and selenium, which can help to prevent hair loss. Incorporating these hair-healthy foods into your diet can make a noticeable difference in the strength, shine, and growth of your hair. So ditch the junk food and fuel your body with the nutrients it needs to grow those luscious locks. Happy scalp, happy hair. Alright, let's talk scalp care, because a healthy scalp is the foundation for healthy hair growth. Think of your scalp as the garden and your hair as the flowers. If the soil is unhealthy, the flowers won't thrive. One of the best things you can do for your scalp is to give it a good massage regularly. Scalp massages help to increase blood flow to the scalp, which can stimulate hair growth and nourish the hair follicles. You can use your fingertips or a scalp massager to gently massage your scalp in circular motions for a few minutes each day. Trust me, it feels amazing and your hair will thank you for it. Another important aspect of scalp care is proper cleansing. Product buildup, dirt and oil can clog your hair follicles and hinder hair growth. Make sure you're using a gentle, sulfate-free shampoo that cleanses your scalp without stripping it of its natural oils. And don't be afraid to shampoo twice if needed, especially if you use a lot of styling products. If you're dealing with a dry, itchy or flaky scalp, you might benefit from using a scalp scrub or treatment. These products can help to exfoliate the scalp, remove buildup, and soothe any irritation. Hydration is key. We all know how important it is to drink enough water for our overall health, but did you know that hydration is also crucial for healthy hair? When you're dehydrated, your hair can become dry, brittle, and prone to breakage. Make sure you're drinking plenty of water throughout the day to keep your body and your hair hydrated from the inside out. And don't forget about external hydration. Using a good moisturizing hair mask or conditioner can work wonders for dry, damaged hair. Look for products that contain hydrating ingredients like hyaluronic acid, shea butter, or coconut oil. These ingredients help to attract and retain moisture, leaving your hair feeling soft, supple, and healthy. Another great way to add moisture to your hair is to use a leave-in conditioner or hair oil. These products can help to tame frizz, add shine, and protect your hair from the elements. Just remember to choose products that are right for your hair type. If you have fine hair, opt for lightweight formulas that won't weigh your hair down. And if you have thick, coarse hair, you can go for richer, more emollient products. And there you have it, my top 7 tips for healthy, strong hair. I hope you found this video helpful and feel empowered to embrace your natural beauty. Remember, healthy hair is a journey, not a destination. Be patient, be consistent with your hair care routine, and most importantly, love the hair you have. Don't forget to hit that notification bell so you never miss an upload. And as always, thank you so much for watching. I'll see you in my next video. Bye.
Have you ever pondered the intricate dance of hormones that takes place within your body during an orgasm? This ballet of biochemistry underscores the importance of understanding our hormonal responses. Today, we delve into the roles and effects of 3 key hormones during an orgasm. Firstly, we explore dopamine, often referred to as the pleasure hormone. Dopamine is a neurotransmitter, a chemical messenger that transmits signals in the brain and other vital areas. It plays a key role in how we feel pleasure. It's also a big part of our unique human ability to plan and think. During an orgasm, there's a significant surge in dopamine levels, amplifying feelings of enjoyment and satisfaction. In essence, dopamine is the hormone that makes an orgasm feel so rewarding. Next, we spotlight oxytocin, also known as the love hormone. This remarkable hormone fosters bonding and intimacy, weaving the intricate tapestry of our emotional well-being. During an orgasm, the release of oxytocin surges, amplifying feelings of affection and closeness. It's an unseen dance, a subtle chemistry that enhances our ability to connect with others on a deeper emotional level. It's more than just a hormone, it's a catalyst for human bonds, a silent whisper of the heart. So, oxytocin is the hormone that deepens our emotional connection during an orgasm. Lastly, we unveil endorphins, our body's natural painkillers. These remarkable hormones leap into action whenever we're under stress or experiencing pain. They're akin to nature's own morphine, dulling discomfort and producing a sense of well-being. During an orgasm, there's a surge of these endorphins, contributing significantly to the euphoria that ensues. This release not only alleviates any physical tension, but also bathes us in a soothing, blissful glow. In short, endorphins are the hormones that help us relax and enjoy the moment during an orgasm. To recap, an orgasm is not just a physical experience, but a hormonal symphony. With dopamine sparking pleasure, oxytocin fostering love, and endorphins easing pain, these hormones perform a captivating dance during an orgasm. Understanding these hormones and their roles can enrich our appreciation of this intricate and fascinating biological process.
Welcome to our channel. Today we're diving into a crucial topic, the negative effects of relationship problems on women's health. You know, folks, we often think about health in terms of diet and exercise, but the truth is, our relationships play a huge role in our overall well-being. And when those relationships are strained, it can have serious consequences for both mental and physical health, especially for women. Stay tuned to learn how these issues can impact every aspect of a woman's life. Now let's talk about the elephant in the room, the mental toll that troubled relationships can take. Ladies, you know what I'm talking about. You're constantly walking on eggshells, never knowing what mood you're going to be dealing with. That kind of stress, that constant tension, it eats away at you. It's like a slow poison. And the worst part is, you might not even realize it's happening until it's too late. You see, stress is a sneaky devil. It creeps in and starts messing with your mind, making you doubt yourself, your worth. You start feeling anxious all the time, like you're waiting for the other shoe to drop. And when that anxiety becomes a constant companion, it can spiral into full-blown depression. Depression is a serious condition, folks. It's not just feeling a little blue, it's a deep, dark hole that can be hard to climb out of. And when you're stuck in that hole, it affects everything. Your sleep, your appetite, your energy, your relationships. Speaking of sleep, let me tell you, chronic stress can wreak havoc on your sleep cycle. You lie awake at night, your mind racing, replaying every argument, every hurtful word. And when you don't get enough sleep, well, it affects everything. You're irritable, you can't focus, you're more likely to make bad decisions. And then there's self-esteem. Being in a toxic relationship can chip away at your self-worth like a hammer and chisel. Every put-down, every criticism, it takes a toll. You start questioning yourself, wondering if you're good enough, smart enough, pretty enough. And when your self-esteem is in the gutter, it affects every aspect of your life. Don't let anyone tell you that these are just women's problems. These are human problems, and they deserve attention and care. You know, we often think of the mind and body as separate entities, but the truth is, they're intimately connected. What affects one affects the other. And when it comes to relationship problems, the physical consequences can be just as devastating as the mental ones. Let's start with the big one. Cardiovascular health. Chronic stress, the kind that comes from constantly being on edge in a troubled relationship. It's like a pressure cooker for your heart. It raises your blood pressure, increases your heart rate, and over time, that can lead to some serious problems like heart disease, stroke, and even heart attacks. Now, you might think you're too young to worry about heart problems, but let me tell you, this stuff can sneak up on you. And the longer you're in a stressful relationship, the greater the risk. But it's not just your heart that takes a hit. Chronic stress weakens your immune system, making you more susceptible to every bug and virus that comes your way. You know how it is. You're constantly fighting off colds, the flu, you name it. That's your body telling you that something's not right. And then there's pain. Chronic pain, the kind that lingers for weeks, months, even years, is often linked to stress. Headaches, back pain, muscle tension, you name it, stress can make it worse. And when you're in a constant state of stress because of your relationship, it's like your body is stuck in overdrive, and eventually something's got to give. And let's not forget about weight. Relationship problems can mess with your appetite and your metabolism, leading to weight fluctuations. Some people lose their appetite and drop pounds, while others find comfort in food and pack on the pounds. Either way, it's your body's way of responding to stress. Let's talk about something that doesn't get enough attention: the impact of relationship problems on women's reproductive health. You see, ladies, our bodies are amazing, intricate systems, but they're also incredibly sensitive to stress. And when we're dealing with constant turmoil in our relationships, it can throw our hormones out of whack, leading to a whole host of reproductive health issues. One of the most common problems is menstrual irregularities. Stress can delay your period, make it heavier or lighter than usual, or even cause you to skip periods altogether. And let me tell you, dealing with irregular periods is no picnic. It's uncomfortable, it's inconvenient, and it can be downright scary. But it doesn't stop there. When you're trying to conceive, stress can actually make it more difficult to get pregnant. It can interfere with ovulation and implantation, making it harder for your body to do what it needs to do to create a healthy pregnancy. And if you do get pregnant, chronic stress can increase the risk of complications like preterm labor, low birth weight, and even miscarriage. Now, I'm not saying this to scare anyone, but it's important to understand the very real impact that stress can have on pregnancy. But here's the thing that really gets me: intimate partner violence. Sadly, for many women, relationship problems escalate beyond arguments and disagreements and turn into physical or emotional abuse. This type of violence is unacceptable, and it can have devastating consequences for both physical and mental health. It's crucial to remember that you are not alone, and there are resources available to help you escape a dangerous situation. Now let's talk about how relationship problems can lead to some pretty unhealthy coping mechanisms. You see, when you're hurting, when you're feeling lost and alone, it's easy to turn to things that numb the pain, even if they're bad for you in the long run. One of the most common ways people cope with relationship problems is through substance abuse. Alcohol, drugs, they might seem like an escape, a way to forget about your troubles for a while. But the truth is, they only make things worse. Addiction is a slippery slope, and it can destroy lives. Then there's social isolation. When you're in a bad relationship, you might start withdrawing from friends and family. You're embarrassed, you don't want to talk about it, so you isolate yourself. But the truth is, you need your support system now more than ever. Talking to someone you trust, whether it's a friend, family member, therapist, or support group, can make a world of difference. And of course, there's neglect of self-care. When you're caught up in the drama of a troubled relationship, it's easy to let yourself go. You stop exercising, you eat whatever you want, you don't get enough sleep. But neglecting your physical and emotional needs only makes things worse. It's important to prioritize self-care, even when it feels impossible. Take some time for yourself, do something you enjoy, and remind yourself that you are worthy of love and care. Now, we've talked about the immediate impacts of relationship problems on women's health, but it's important to understand that the consequences can be far-reaching. You see, when you're dealing with chronic stress and unhealthy coping mechanisms, it takes a toll on your body and mind, and over time, that can lead to some serious long-term health issues. One of the biggest concerns is the increased risk of chronic diseases. We're talking about things like heart disease, stroke, diabetes, autoimmune disorders, even certain types of cancer. These are serious, life-altering conditions, and the scary part is, they often develop silently over many years. But it's not just physical health that's at risk. Prolonged exposure to stress can also lead to the development of psychosomatic disorders. These are physical symptoms that are rooted in psychological distress. So, we're talking about things like chronic pain, digestive problems, skin disorders, even hair loss. Now, I know this might sound overwhelming, but the good news is, There are things you can do to mitigate the risks. The first step is acknowledging that there's a problem. Don't minimize your feelings or try to tough it out on your own. Next, seek professional help. A therapist can help you develop healthy coping mechanisms for dealing with stress and work through the underlying issues that are contributing to your relationship problems. Remember, asking for help is a sign of strength, not weakness. It's also important to prioritize self-care. Make sure you're eating a healthy diet, getting regular exercise, and getting enough sleep. And don't forget about the importance of stress-reducing activities like yoga, meditation, or spending time in nature. And finally, surround yourself with a supportive network of friends and family. These are the people who will love you unconditionally and help you through tough times. Don't be afraid to reach out for support when you need it. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Remember, addressing relationship problems is key to improving overall health and well-being. Don't let unhealthy relationships continue to impact your well-being. Seek help, prioritize self-care, and remember that you deserve to be in a healthy, supportive relationship. Take care.
Polycystic ovarian syndrome, common called PCOS, is the most common hormonal abnormality in reproductive-aged women, affecting approximately 5 to 10% of population. It is the most common cause of infertility in women. The symptoms of PCOS may begin in adolescence with menstrual irregularities, or a woman may not know she has PCOS until later in life when symptoms and/or infertility occur. The principal signs and symptoms of PCOS are related to menstrual disturbances and elevated levels of male hormones, androgens, and obesity. Menstrual disturbances can include delay of normal menstruation, the presence of fewer than normal menstrual periods, or the absence of menstruation for more than 3 months secondary amenorrhea. Menstrual cycles may not be associated with ovulation and ovulatory cycles and may result in heavy bleeding. Symptoms related to elevated androgen levels include acne, excess hair growth on the body, and male pattern hair loss. Other signs and symptoms of PCOS include obesity and weight gain, oily skin, dandruff, skin discolorations, high cholesterol levels, elevated blood pressure, and multiple small cysts in the ovaries. Any of the above symptoms and signs may be absent in PCOS, except for irregular or no menstrual periods. All women with PCOS will have irregular or no menstrual periods. Women who have PCOS do not regularly ovulate. That is, they do not release an egg every month. This is why they do not have regular periods and typically have difficulty conceiving. PCOS involves a vicious cycle of hormonal imbalance that may begin with oversensitivity of the pituitary to gonadotrophin-releasing hormone. The pituitary responds with an increase in luteinizing hormone secretion, resulting in increased ovarian androgen production. Consequently, FSH production is inhibited, thereby further preventing follicle development and ovulation. Additionally, estrogen proliferates the endometrium unopposed and increases the risk of endometrial hyperplasia. What causes polycystic ovarian syndrome? No one is quite sure what causes polycystic ovarian syndrome, and it is likely to be the result of a number of both genetic, inherited, as well as environmental factors. Women with PCOS often have a mother or sister with the condition, and researchers are examining the role that genetics or gene mutations might play in its development. The ovaries of women with PCOS frequently contain several small cysts. A similar number of cysts may occur in women without PCOS. Therefore, the cysts themselves do not seem to be the cause of the problem. A malfunction of the body's blood sugar control system is frequent in women with PCOS, who often have insulin resistance and elevated blood insulin levels, and researchers believe that these abnormalities may be related to the development of PCOS. It is also known that the ovaries of women with PCOS produce excess amounts of male hormones known as androgens. This excessive production of male hormones may be a result of or related to the abnormalities in insulin production. Another hormonal abnormality in women with PCOS is excessive production of the luteinizing hormone LH, which is involved in stimulating the ovaries to produce hormones and is released from the pituitary gland in the brain. Other possible contributing factors in the development of PCOS may include a low level of chronic inflammation in the body and fetal exposure to male hormones. Let's explain the clinical presentation in polycystic ovarian syndrome. A. Infertility. Approximately 40% of female infertility factors result from ovulation problems. Women with PCOS may experience a wide range of ovulation problems, from infrequent ovulation to anovulation. In addition to anovulation, other factors appear to be involved, as these women may have a lower rate of conception in response to ovulation-inducing agents in comparison to women with hypothalamic amenorrhea, which is ovulation problem resulting from malfunction of this part of the brain. Many studies have also described the almost twofold increased miscarriage rate in PCOS. B. Abnormal uterine bleeding and endometrial hyperplasia. Due to chronic anovulation, women with PCOS usually have irregular menstrual bleeding. The high androgens levels can be converted peripherally to estrogens, even in the absence of normal ovarian function. As a result, these women are exposed to continuous unopposed estrogen stimulation of the endometrium. Due to no ovulation, they are deficient in progesterone secretion, which is needed for endometrial differentiation and withdrawal bleeding. Thus, they are at risk for dysfunctional uterine bleeding and ultimately endometrial hyperplasia and/or carcinoma. C. High androgen. The clinical features of androgen excess in women with PCOS include hirsutism, acne, male pattern balding, and rarely signs of virilization, including deepening of the voice, increased muscle mass, and clitoromegaly. Hirsutism occurs in approximately 70–80% of PCOS patients and is defined as the conversion of vellus to terminal in a male pattern distribution along sex-dependent regions, e.g. upper lip, around the nipple, and lower abdomen. D. Obesity. Obesity is a common but not necessary finding in at least 50% to 65% of women with PCOS. Patients usually have central body fat distribution. Android obesity, which is characterized by increased waist-to-hip ratio, is correlated with increased plasma testosterone, decreased sex hormone-binding globulin, increased insulin, impaired glucose tolerance, and abnormal level of lipids in the blood. E. Insulin resistance and diabetes. Many women with PCOS exhibit insulin resistance and hyperinsulinemia. Although it is more commonly associated with obesity, it is also found in normal weight women with PCOS. Because of insulin resistance, women with PCOS are at increased risk for impaired glucose tolerance and diabetes mellitus. A recent study determined that up to 40% of obese reproductive age women with PCOS had impaired glucose tolerance and 7.5% had diabetes mellitus. In addition, 15% of normal weight women with PCOS had impaired glucose tolerance and 1.5% had diabetes, a rate almost 3 times that of the general population. The underlying reason for insulin resistance remains unclear. It has been reported that insulin resistance may be related to decreased insulin receptor processing in about 50% of women with PCOS. If untreated, insulin resistance leads to diabetes in approximately 1/3 of patients. F. Possible predisposition to coronary heart disease. Insulin resistance is a key finding along with elevated cholesterol, triglycerides, blood pressure, and waist circumference. The presence of obesity, insulin resistance, and lipid abnormalities may predispose women with PCOS to coronary heart disease. Several studies have shown that women with PCOS have abnormal levels of LDL, bad, cholesterol, and lowered levels of HDL, good, cholesterol in the blood. How do we diagnose polycystic ovarian syndrome? PCOS is usually diagnosed in women who present with infrequent menstrual intervals greater than 35 days, elevated testosterone or hirsutism, acne and obesity, after excluding other hormonal disorders. However, most women with PCOS do not exhibit all of these features, and there is a considerable controversy about the definition and required criteria for the diagnosis. The new criteria include 2 of the following 3 signs: ovulation dysfunction, excessive hair growth and/or acne, and polycystic appearing ovaries on ultrasound. The diagnosis of PCOS does not require the presence of polycystic ovaries on ultrasound, since approximately 20% of fertile women may have polycystic appearing ovaries. Polycystic ovaries are present in more than 90% of women with PCOS, but may sometimes be absent in women with all the other clinical characteristics of PCOS. Polycystic ovary syndrome is primarily a clinical diagnosis, and laboratory findings should only be used to support the clinical testing and rule out other serious disorders. How should polycystic ovarian syndrome be managed? It is important to emphasize that women with PCOS experience a significant psychological, social, and economic burden that might be lessened via more awareness, better treatment options, and more support. 1. Weight reduction, diet, and exercise are recommended for all women with PCOS. Some studies have also shown a 5 to 10% loss in body weight may result in a return of ovulatory cycles and a higher spontaneous pregnancy rate. However, it is very difficult for PCOS patients to lose weight. If body weight is reduced, it is also difficult to maintain due to a variety of reasons. 2. Monthly progesterone therapy can be used to prevent abnormal endometrial proliferation by inducing withdrawal bleeding. Another option for these women is to use low-dose oral contraceptive pills to regulate the menstrual cycle and provide contraception. 3. Anti-androgens may be combined with oral contraceptive pills for the treatment of hirsutism and acne. Also, for acne or excess hair growth, a water pill, called spironolactone, may be prescribed to help reverse these problems. The use of spironolactone requires occasional monitoring of blood tests because of its potential effect on the blood potassium levels and kidney function. 4. Treatment of facial hair. Vanica is a cream medication that can be used to slow facial hair growth in women. Electrolysis and over-the-counter depilatory creams are other options for controlling excess hair growth. Hair removal using laser and non-laser light sources damages individual hair follicles, so they do not grow back. This can be expensive and multiple treatments are needed. Laser removal can be combined with other medicines and hormones. 5. Ovulation induction. In patients desiring pregnancy, ovulation induction is often required, usually with clomiphene citrate. Approximately 80% of women with PCOS ovulate in response to clomiphene, but only about 40% of them become pregnant. Most recently, an enzyme inhibitor of aromatase has been shown to have equal success as clomiphene with ovulation, but less of a negative impact on endometrial proliferation. 6. Treatment of insulin resistance. Insulin resistance has been implicated in the reproductive consequences of PCOS, namely infertility, miscarriage, and gestational diabetes. Multiple studies have supported the use of metformin to ameliorate these problems. Metformin sensitizes cells to insulin, and PCOS patients typically have abnormally high level of insulin in the blood. It works by activating glucose transporters, which allow passage of glucose into liver and muscle cells, thereby decreasing peripheral insulin resistance. It is useful in reducing a number of the symptoms and complications of PCOS and in the management of irregular periods, ovulation induction, weight loss, prevention of type 2 diabetes, and gestation diabetes in women with PCOS. 7. Ovarian surgery has been an effective therapy for patients resistant to medication. Laparoscopy with bilateral ovarian diathermy involves drilling holes in the ovary, utilizing electrocutory or laser, providing an approximate 84% ovulation induction rate and 56% pregnancy rate with maintenance of ovulation demonstrated for up to 20 years in the majority of patients. In conclusion, women with polycystic ovarian syndrome need early diagnosis, treatment, and support. Early intervention reduces symptoms, prevents complications, and improves quality of life. Understanding, support, and advocacy for women with PCOS may promote a more inclusive and friendly atmosphere. Thanks for watching, and if you found this video helpful, be sure to like, share, and kindly subscribe to allow us to continue to make more contents like this one. If you find this interesting, you will also find more of our displayed link videos interesting as well.
Hi everyone, and welcome to this YouTube video on healthy eating made easy. Surrounded by tempting and convenient unhealthy food options, sticking to a nutritious diet can be challenging. However, eating well doesn't have to be complicated or time-consuming. With simple tips and tricks, you can make healthy eating part of your daily routine. In this video, we'll share practical nutrition tips to help you achieve your health goals. Ready to change your diet and overall health? Keep watching. Tip number 1 is meal planning and preparation. Meal planning and preparation is an excellent strategy to help you eat healthier and stick to your diet goals. By planning and preparing your meals in advance, you have complete control over what goes into your food and how much you eat. This can be especially helpful if you have a busy schedule or find it challenging to make healthy choices on the go. To get started with meal prep, set aside a few weekend hours to plan your meals for the upcoming week. Consider your dietary needs and preferences and choose recipes that you enjoy and that fit your nutritional goals. You can find meal prep ideas and recipes online or in cookbooks. Once you've selected your recipes, make a grocery list and head to the store. Stock up on all the ingredients you'll need for the week and grab some meal prep containers. These containers are convenient and reusable, making them an eco-friendly option. When you're ready to start prepping, choose a day and time when you have a few hours to spare. Begin by washing and chopping your vegetables, cooking your proteins, and portioning your carbs. Then, assemble your meals in the containers and label them with the date and contents. Having your meals ready to go in the fridge or freezer can be a lifesaver during busy work days or when you don't have the energy to cook. Plus, prepping your meals makes you less likely to reach for unhealthy snacks or takeout food when you're hungry. Tip number 2 is stay hydrated. Drink water. Staying hydrated is crucial for maintaining good health and promoting wellness. Water makes up a significant portion of our body and helps to regulate body temperature, transport nutrients, and remove waste products. Therefore, we must ensure we're drinking enough water throughout the day. Dehydration can cause many health problems, including fatigue, headaches, and constipation. It can also lead to overeating, as thirst is often mistaken for hunger. You can avoid these issues and feel your best by staying adequately hydrated. One way to ensure you're drinking enough water is to carry a water bottle throughout the day. This way, you can easily access water and sip on it whenever necessary. Choose a water bottle that's easy to carry and refill, and ensure its BPA-free and durable. The amount of water you need to drink daily can vary based on age, sex, and activity level. However, a general guideline is to aim for 8 glasses of water daily or around 2 liters. If you're active or live in a hot climate, you may need to drink more water to stay adequately hydrated. Besides water, other hydrating options include herbal tea, coconut water, and low-sugar fruit juices. However, it's important to watch out for sugary drinks, which can cause dehydration and have negative health effects. Additionally, caffeinated drinks like coffee and soda can have a diuretic effect and lead to dehydration if consumed excessively. Tip number 3 is reading nutrition labels. Reading nutrition labels is essential for making informed decisions about your food choices. It's important to understand what ingredients are in your food, how much of each ingredient is present, and how those ingredients impact your health. The nutrition label provides valuable information about a food item's serving size, calories, and nutrient content. It also lists the ingredients, which can help you identify any potential allergens or ingredients you want to avoid. When reading a nutrition label, start by checking the serving size. Many products contain multiple servings, so it's important to know how much food you eat. Then, look at the calorie count to determine if the food fits your daily calorie goals. Next, consider the macronutrient content, including fat, saturated fat, protein, and carbohydrate. Aim for items that are low in saturated fat and added sugars and high in fiber and protein. Look for whole grains, lean proteins, and nutrient-dense foods like fruits and vegetables. It's also important to check the ingredient list for hidden or harmful ingredients. Watch out for added sugars, artificial sweeteners, and trans fats, which can negatively affect health. If you need help interpreting a nutrition label, feel free to ask for help from a nutritionist or healthcare provider. They can help you understand how to read the label and make informed food choices. Tip number 4 is incorporate healthy snacks into your diet. Incorporating healthy snacks into your diet is a great way to keep your energy levels up and avoid overeating. Snacking can also help you control your hunger and prevent unhealthy food cravings, which can lead to overeating eating and weight gain. When it comes to snacking, it's important to choose healthy, nutritious, and satisfying options. Fresh fruits and vegetables are great options as they are low in calories and high in fiber, vitamins, and minerals. Nuts and seeds are healthy snacks with healthy fats, protein, and fiber. Try to avoid snacking on highly processed foods that are high in sugar and unhealthy fat. These foods can cause a spike in blood sugar levels, leading to later crashes and fatigue. Instead, opt for whole, nutrient-dense foods that nourish your body and keep you full and satisfied. To make healthy snacking easier, try prepping snacks in advance. Cut fresh fruits and veggies and portion nuts and seeds into snack-sized bags. This way, you can grab a healthy snack and avoid reaching for unhealthy options. It's also important to listen to your body and snack when hungry. Eating smaller, more frequent meals throughout the day can help keep your metabolism going and prevent overeating. Pay attention to portion sizes and avoid mindlessly snacking in front of the TV or computer. Tip number 5 is focus on whole foods. Focusing on whole foods is an excellent way to improve your diet and overall health. Whole foods are unprocessed or minimally processed and are generally free from added sugars, artificial flavors, and preservatives. Instead, they are packed with essential nutrients like fiber, vitamins, and minerals essential for optimal health. Eating a diet rich in whole foods can help reduce the risk of chronic diseases like heart disease, diabetes, and cancer. Fruits and vegetables in particular are high in antioxidants, which can help protect your body from oxidative stress and inflammation. Whole grains like brown rice, quinoa, and oats are also excellent sources of fiber, which can help improve digestive health, regulate blood sugar levels, and lower cholesterol. Lean proteins like chicken, fish, and tofu are important for maintaining muscle mass, supporting immune function, and providing energy. To incorporate more whole foods into your diet, try filling your plate with colorful fruits and vegetables at every meal. Choose whole grains like brown rice, whole wheat bread, and quinoa over processed grains like white rice and white bread. Regarding protein, opt for lean sources like chicken, fish, and tofu. Limiting your intake of highly processed foods, which can be high in calories, sugar, and unhealthy fats, is also important. These foods can contribute to weight gain and chronic diseases like heart disease and diabetes. Instead, focus on whole, nutrient-dense foods that nourish your body and provide the energy you need to thrive. They have healthy eating made easy. For more educative video content, subscribe and turn on your notification. Please share the video with your friends so they can learn from it too. We would love to see your comments, so keep them coming. Hi everyone, and welcome to Women Health Project. In today's video, we'll be exploring the top 7 online businesses for moms who stay at the home. Are you a mom who stay at the home with an entrepreneurial spirit? Get inspired by these 7 online business ideas that can help you achieve financial independence. With these ideas, you can turn your passions into profit while balancing family life. From blogging to YouTube channels, there's something for every mom. I'll provide tips on how to start, grow, and succeed in each venture. Don't forget to like and subscribe for more helpful content. Let's dive in. Number 7 is freelance virtual or hybrid services. Freelancing allows you to work from home and choose projects aligned with your interests. You can start by showcasing your skills in a professional portfolio. Join platforms like People Per Hour, the UK's version of Fiverr and Upwork, to find clients and set your rates in pounds sterling. You can network online to grow your business while balancing family life. Freelancing offers flexibility and financial stability to empower moms who stay at the home. It helps to build successful careers while being present for their families. Number 6 is become a blogger or an influencer. Consider platforms like TikTok and Instagram for higher engagement. Building a substantial following takes time, so patience and perseverance are crucial. Once established, the rewards can be significant, with the potential for 6 or even 7-figure incomes. Stick to one niche, be consistent, and share your passion and knowledge with your audience. Becoming a successful blogger or influencer offers the opportunity for financial transformation while sharing your experiences with the world. Number 5 is make and sell homemade meals. Combine your culinary skills with entrepreneurship by selling homemade meals. Identify your target market and create a menu that caters to their needs. Establish a strong online presence through Instagram, Facebook, and a website. showcasing your dishes and offering promotions to attract new customers. Customer reviews and testimonials can boost credibility and attract more clients. This opportunity allows moms who stay at the home to generate income while sharing their passion for cooking and staying close to their families. Number 4 is create and sell digital products. Digital products offer passive income potential by creating once and selling multiple times. Choose from options like ebooks, online courses, or graphic design templates based on your expertise or passion. List your products on platforms like Etsy, Amazon Kindle Direct Publishing, or your own website. Use social media, email marketing, and collaborations to reach a wider audience. This opportunity provides flexibility to moms who stay at the home and the potential for substantial income while working at their own pace to support their families. Number 3 is create and sell arts or crafts. Turn your creative talents into profit by making and selling handmade art or crafts. Set up an online store with platforms like Etsy catering to handmade items. Utilize social media such as Instagram and Pinterest to showcase your work and connect with customers. Invest in high-quality product photos and compelling descriptions. Expand your reach by participating in craft fairs or collaborating with other artisans. For moms who stay at the home, this opportunity provides income while expressing creativity and sharing unique talent. Number 2 is start a YouTube channel. YouTube provides a vast platform to share your passions and expertise with a global audience of over 2 billion monthly users. Choose a niche that aligns with your interests and develop engaging content to attract viewers. Consistency is key, so stick to a posting schedule and engage with your audience. Optimize your videos for search results and promote your channel on social media to increase visibility. Starting a YouTube channel offers flexibility for moms who stay at the home to work on their own terms while connecting with others. It helps to potentially generating income through ad revenue, sponsorships, and merchandise sales. With dedication, your channel can grow into a successful online business to support your family. Number 1 is start an online shop to resell items. This business model involves purchasing products at a low cost and reselling them for a profit through your online store. Research the market, source inventory, and list items on platforms like eBay or Amazon. Utilize social media and online promotion to increase visibility. Starting an online shop offers flexibility, scalability, and potential profits for moms who stay at the home. Choose the idea that resonates with you and take action towards financial success and flexibility. Thanks for watching. If you found this video helpful, be sure to like, share, and subscribe us for more content like this. You will also find more of our displayed link videos interesting as well.
Vaginismus. Vaginismus is when the muscles around your vagina tighten involuntarily whenever there is an attempt to penetrate it with something. This could be your partner's penis, your finger, vaginal devices, or a tampon. Vaginismus makes sexual intercourse difficult or impossible. The vagina can completely close up, and it can be painful. The symptoms can vary from one woman to the next. Because it disrupts or completely stops your sex life, vaginismus can cause distress and relationship problems and may prevent you from starting a family. It can also make gynaecological and pelvic examinations difficult or impossible. In some cases, a woman may need an anesthetic before a doctor can examine her. The condition is fairly common, especially in teenage girls and women in their 20s and 30s. It is likely that many women will experience it at some point, even if they have had a history of enjoyable and painless sex. Types of vaginismus. There are 2 types of vaginismus. Primary vaginismus is when you have never been able to have sex because of the condition. Secondary vaginismus is when you have previously been able to have sex but now find it difficult or impossible. Causes of vaginismus. Many factors can cause vaginismus, but it is not always fully understood why the condition happens. For some women, it may be caused by a traumatic past experience, such as a difficult childbirth or sexual abuse. They may associate sexual activity with pain and learn to avoid intercourse as a way of avoiding further pain. Sexual issues. There are various different sexual experiences or issues to do with sex which may contribute to vaginismus. An unpleasant sexual experience at a young age, such as a clumsy, painful sexual encounter or examination, can make the body respond in a protective way to stop further pain. Sexual abuse, assault or rape could also cause vaginismus. Having difficulty understanding sex, or having feelings of shame or guilt around sex, could also contribute to vaginismus. For example, you might feel uncomfortable with sex if a. You've had a very strict upbringing where it was never discussed. b. You have been told that sexual desire is wrong or sex is painful. c. You are affected by cultural or religious taboos around sex. Causes of pain during sex. Any causes of pain during sexual intercourse, dyspareunia, may lead to a woman developing a fear of painful sex. Research suggests that the fear of painful sex may be an important contributing factor to vaginismus. The following may all cause painful sexual intercourse: previous surgery to the genital area, an infection of the genital area, radiotherapy to the pelvic area, vaginal dryness, which can occur after the menopause, lack of sexual arousal. Endometriosis and pelvic inflammatory disease are both conditions that can cause pain deeper within the pelvis, including pain during sexual intercourse. Symptoms of vaginismus. Symptoms of vaginismus include the following: difficult or impossible penetration of the vagina, because the muscles in the vagina have tightened. Burning or stinging pain and tightness of the vagina if penetrated by a tampon, finger or penis. Fear of pain. Intense fear of penetration and avoidance of sex. Loss of sexual desire if penetration is attempted. Symptoms of vaginismus vary in severity. Some women are unable to insert anything into their vagina. Some women can insert a tampon and complete a gynaecological exam, but intercourse isn't possible. Other women can try to have intercourse, but it is very painful. Some women are able to have intercourse, but tightness and pain prevent. Some women experience years of occasional difficulty with sex and have to be constantly ready to control and relax their vagina when the symptoms occur. Symptoms of vaginismus are completely involuntary and you cannot do anything to stop them. The body has learned to associate penetration with pain. Whenever the body expects penetration, the vaginal muscles tighten as a protective reaction. It is not true that women who have vaginismus do not like or do not want to have sex. Many women with vaginismus enjoy closeness and share sexual pleasure with their partner. They can achieve orgasm during mutual masturbation, foreplay and oral sex. It is only when sexual intercourse is suggested or attempted that the vagina tightens to prevent penetration. Diagnosing vaginismus. The diagnosis of vaginismus is based on your medical history, your symptoms and a physical examination, if possible. It is helpful to have detailed information on possible causes described above. This often involves reflecting on quite personal issues, such as history of previous traumatic sexual experience. An examination of the genital area is necessary to rule out a physical cause of vaginismus, such as injury or infection. You may also need to be referred for some counseling, and you could suggest it to your partner too. Treating vaginismus. Treatment of vaginismus depends on whether the cause can be identified. If there is an obvious physical cause, such as an injury or infection, this can be treated with appropriate medication. If the cause is psychological, it may be treated using sex therapy, where you are helped to gradually overcome it using vaginal trainers and relaxation techniques. You will be given counseling or cognitive behavioral therapy, if necessary. Sex therapy. Sex therapists will give advice on self-help techniques and may offer counseling to address any underlying psychological issues, such as fear or anxiety, or arrange cognitive behavioral therapy to change any irrational or incorrect beliefs about sex and, if necessary, to educate you about sex. Your treatment plan will be based on your needs. You will be encouraged to take full control of your self-help treatment and go at your own pace. If you have a partner, they can also be involved in your treatment. Vaginal trainers. A technique to relax the muscles in the vagina involves using a set of vaginal trainers. These are 4 smooth, penis-shaped cones of gradually increasing size and length, which can be used in the privacy of your own home. The smallest one is inserted first, using a lubricant if needed. Once you feel comfortable inserting the smallest one, you can move on to the second size, and so on. It is important to go at your own pace and it does not matter how long it takes, whether it is days or months. When you can tolerate the larger cones without feeling anxious or any pain, you and your partner may want to try having sexual intercourse. It is important to note that in cases of vaginismus the vaginal cones are not stretching, a vagina that is too narrow. Women who experience vaginismus have a perfectly normal-sized vagina. The cones are simply teaching the vagina to accept penetration without automatically contracting the pelvic floor muscles. Relaxation and touching. If the cone method is not right for you, relaxation and exploration exercises may help. Bath, massage and breathing exercises are good ways to relax while you get to know your body. Your therapist may also teach you a technique called progressive relaxation. This involves tensing and relaxing different muscles in your body in a particular order. You can then practice tensing and relaxing your pelvic floor muscles before trying to insert your finger or a cone. If you reach the stage where you can put your finger inside your vagina, you can try to insert a tampon, using lubricant if needed. It is important to take things slowly and gently and, when you are ready for intercourse, make sure you are fully aroused before attempting penetration. Sensate focus. If you are in a relationship, you could try sensate focus. This is a type of sex therapy that you and your partner complete together. It starts with you both agreeing not to have sex for a number of weeks or months. During this time, you can still touch each other, but not in the genital area, or a woman's breasts. Set aside a time when it is just the two of you. Massage, touch or stroke each other, with or without clothes on. Explore your bodies, knowing that you will not have sex. After the agreed period of time has passed, you can begin touching each other's genital areas. You may want to spend several weeks gradually increasing the amount of time spent touching the genital areas. You can also begin to use your mouth to touch your partner, for example, licking or kissing them. This can build up to include penetrative sex. Enlarging the vagina. Surgery can be carried out to enlarge your vagina. This may be necessary if, for example, previous surgery to this area has meant that scar tissue has formed and is either blocking or restricting your vagina. This can occur if it was necessary for doctors to make a cut in your perineum during childbirth. A small operation called a Fenton's procedure can be done to remove the scar tissue. The operation involves neatly cutting out the scar tissue and sewing together the clean-cut edges with small stitches. These should dissolve on their own after a few weeks. The operation will be carried out under either local anesthetic or general anesthetic. Botox treatment for vaginismus and vulvodynia. Botox, a drug derived from a botulinum toxin, interferes with the transmission of a chemical, acetylcholine, that is responsible for muscle activation. When administered correctly, Botox is as safe as aspirin. Botox has been used for decades to weaken overactive muscles and glands in patients with conditions such as cerebral palsy, stroke, excessive sweating, and migraines, as well as for cosmetic purposes. First used in 1997 for the treatment of vaginismus, Botox prevents the involuntary spasms that define this condition, allowing women to progressively dilate more comfortably and overcome their fear of penetration. Botox shows few side effects, vaginal dryness being the most common. Botox achieves successful treatment by numbing the pain-sensitive nerves causing the pain at rest or pain with insertion of tampons, or pain at intercourse. It is important to ensure that there is no limiting skin band causing the pain at penetration, as this will usually need minor surgical treatment. After the procedure, you will immediately find that you have already achieved what is usually the hardest first step, the insertion of the first dilator. The anesthesia works to ensure that your first experience with the dilator is without much pain, if any, at all. In fact, most patients report that the presence of the dilator does not cause any concern or pain. Results. What has been observed in research on the use of Botox for vaginismus and vulvodynia is a very high, 75 to 80% rate of success, meaning pain-free intercourse, within 2 to 8 weeks of the treatment. A success rate of 90% has been reported in some clinic series, Patrick 2009. Although Botox only lasts 3 to 4 months when used cosmetically, once the vagina is dilated, additional treatment is generally not necessary. Do subscribe to this channel, also like, comment, and share the video, and follow some of the links in the description to explore availability that may help manage your painful period.